Thank you. Thank you. I appreciate it.
Let me dissent.
Yeah, we'll go the other way.
So on healthcare, we see things a little differently, just to say the least. I think. It's nice to say. We got an interesting report from the chief actuary, Rick Foster, at Medicare on Friday. National health expenditures increased $311 billion. The federal commitment to health care increases $251 billion. As soon as this doc fix is fully passed, the claim of deficit reduction evaporates right away. The only way under this kind of an architecture of a healthcare system to achieve these kinds of savings, these fiscal savings, is to deeply and systematically ration care. I know ration's a word people don't like to use, and it happens and it occurs in many ways, but I don't think it ought to occur primarily from Washington. And so I think this bill, this healthcare framework, is a fiscal train wreck. We used to say the big three entitlements: Medicare, Medicaid, Social Security. Well, we got four now. And this fourth one basically says to people, once it's up and running, if you make less than $100,000 a year, which is most people in America, and your health care expenses exceed anywhere from 2 to 9% of your income, don't worry about it. Federal government's got you covered. They're going to pick up the rest of the tab. That is the creation of the largest entitlement we've had. It's the biggest piece of social legislation to have passed since 1965, and I have no doubt in my mind that it's going to exacerbate our fiscal problems.
I'm going to let Neera Tanden respond, and then I'm going to keep this.
Yeah, no.